Hi, I'm Dr Mohana. I'm a Paediatrician and I work at Petite Practice. I have a subspecialty in pediatric allergy and immunology in addition to general pediatrics. So when we talk about milestones, there are actually 4 major domains, and that would be your gross motor, your fine motor development, your speech and language, as well as the social development of the child. So usually the first few milestones come on with social development from the age of about 6 weeks to 8 weeks of life, where you first notice your baby smiling at you. That's what we call a social smile, where you get social interaction with the baby as well. So that's your very first major social milestone. And then this usually goes on to interaction with caregivers, with a bit of cooing and laughing. Laughing comes on at about 6 months of age. And as the baby grows and develops closer to 1, they start being able to do simple things like waving bye-bye or clapping their hands. And that's where the social domains are in the first year of life. So at 1 year of age, a bit of receptive speech then starts developing. We call this receptive because it comes with understanding. So babies then start being able to understand very simple instructions like no, or take a ball and give it to mommy, right? And instructions like that. When it comes to your gross motor milestones, that starts from about 2 to 3 months of age, when babies during tummy time are able to lift their heads up a little bit with good tone. And that goes on to between 5 to 6 months of being able to turn and roll back to front and front to back. Babies are usually able to sit up on their own unsupported closer to 9 months of age. And at 9 months is also when some babies might start to crawl. But you have to understand that crawling is not a necessary phase of development. So some babies completely skip that, and that's all right, because they're able to get around through other methods. So some babies are bottom shufflers. They use their bumps to shift and move around. And others might just go on to start to walk very early. At about 1 year of age then, babies are able to pull up to stand, and some of them might start cruising, which is taking a few steps while holding on to support. For fine motor development, babies are usually able to reach out and grab objects from about 4 months of age. And they're able to do finer movements such as picking up small objects, or what we call a pincer grasp, at 9 to 10 months of age. So in the first year of life, developmental checkups usually coincide with what we call our developmental touch points, where pediatricians do need to check in to assess that the babies are meeting their milestones. These, out of convenience, actually are timed very nicely with vaccinations which are due. So in the first year of life, the first checkup usually comes in at 6 weeks to 2 months of the baby's life, and then usually at 4 months, 6 months, 9 months, and then a year of age. So this would be a common schedule that we follow for our developmental checkups. So during these checkups, the pediatrician or doctor would check in with your child to assess if they are meeting these 4 domains of development: the gross motor, fine motor, speech and language, as well as social development of the babies. We also check on their baby's height, your weight, and how the growth and nutrition of baby is doing, how they are feeding, and we give you advice on common conditions which you might encounter at these different time points, illnesses, or even wellness advice on how to feed or introduce solids to baby when it's an appropriate age. I would say the most common nutritional concern comes with the development of picky eating. So there are certain children who completely avoid food groups in their diet. So some may be very picky, completely with vegetables, not having any, or some might not like textures of proteins and exclude these from their diet. So nutritional concerns usually come in with very picky eaters who are not getting either their macronutrients, which is your carbohydrates, proteins, or fats in your diet, or even micronutrients, which is your vitamins and minerals that come in through a good intake of fruits and vegetables. When there are specific concerns, sometimes this might affect the growth of a child or other forms of development such as energy levels or sleep. development as well. So weaning to solids typically starts at 6 months of age, and this is assessed with readiness of solids. When babies look interested, they're able to support themselves with good neck and back control, and they are also able to put food into their mouth without trusting or spitting that out too much. So when solids are first introduced, it's usually a very casual process where we are both getting used to the baby trying new foods. The parents are also getting used to how babies react to this. And we start with very basic and safe foods such as healthy fruits or vegetables or grains and cereals as well. And these are usually introduced in a consistency of textures they've been used to before, which is very watery, pureed, like a milk consistency. Before that is progressed on, and less textures, or rather the textures develop over time. So the very first bit of introduction to solids is pretty much exploratory to introduce a variety of tastes and textures to baby as well in the first few weeks. Getting used to baby ingesting foods, but sometimes it's a lot of spit-ups, and it does take quite a few instances of reintroductions before some babies are able to accept foods, and that's all right.